UNFPA embraces a half a century of partnership with the government and the people of the Philippines that goes back to 1969, when a Filipino former executive secretary, Mr. Rafael Salas, became the first executive director of the newly created UNFPA in New York, and its country office was established in the Philippines as well. Mr. Salas oversaw the birth of UNFPA, nurtured it with care, and imbued it with his foresight and vision. Under his leadership, UNFPA grew from a small organization to the world's largest provider of multilateral development assistance on population dynamics, with a promotion of sexual and reproductive health and rights for all, and gender equality at its heart. UNFPA's first country program for the Philippines supported the implementation of the National Population Program that the government had launched in 1970. The second country program of UNFPA from 1980 to 1988 empowered health service providers through family planning training sessions. In 1994, UNFPA and civil society helped drive the landmark International Conference on Population and Development in Cairo, Egypt, where 179 governments, including the Philippines, agreed on a call for all people to have access to comprehensive reproductive health care, including voluntary family planning and safe pregnancy and childbirth services.
I was there in Cairo in 1994. It really was a social revolution. I saw how UNFPA, civil society, and countries, the Philippines included, worked together to shift the focus of global discussions on population from population targets and numbers to putting the needs, choices, rights, and aspirations of human beings at the center of sustainable development. What was agreed in ICPD is very much valid today. Women, couples, and girls should be able to decide for themselves whether, when, or how often to become pregnant, because if you plan your family, you can plan your life.
The country's fertility rate in 1969 was more than 6 children per woman. The number has gone down to 2.7 children per one Filipino woman in 2017. Fertility decline has been supported by increasing use of family planning methods from 10% in 1973 to 40% in 2017.
UNFPA has been and continues to be a valued partner for the Philippine government that supports us in achieving the National Development Plan targets and the ICPD Program of Action. Today, our commitment to the ICPD is made even stronger through our Responsible Parenthood and Reproductive Health Law. The RPRH law was passed in 2012 with support from the UNFPA. The law allows women, especially the poor and marginalized, to access quality voluntary family planning services. Also, when the mega-scale Typhoon Haiyan hit the Philippines, UNFPA was among the first to respond. UNFPA quickly deployed its personnel and provided life-saving reproductive health care for pregnant and lactating women, hygiene supplies to young girls, family planning supplies to affected communities, and women-friendly spaces for the victims and survivors of violence. It is in the spirit of UNFPA's partnership and commitment to the Filipino people that we look to our future work with UNFPA, because much still needs to be done in order to realize the 2030 Agenda for Sustainable Development and fulfill the Filipino people's aspirations, that is the Ambisyon Natin 2040.
The future of the Philippines depends on the empowerment of young people.
We play a critical role in the country's development. We are, after all, about a third of the population. What we can do now for the next 25 years is critical for our future. Later this year, in November, the governments of Kenya, Denmark, and UNFPA are convening a global summit in Nairobi to mark the 25th anniversary of the ICPD, for member states to express their renewed political and financial commitments towards the promises that they had made in Cairo 25 years ago.
This year, UNFPA has started its new 5-year 8th country program that covers from 2019 to 2023. Evidence-based policy advisory assistance for this youthful country to reap a demographic dividend is one of the priority areas of UNFPA's program. UNFPA will also continue to support the full implementation of the Responsible Parenthood and Reproductive Health Act and the revamped National Family Planning Program to further reduce maternal mortality and the President's executive order to end unmet needs for family planning. UNFPA will also continue to help address gender-based violence anytime and anywhere, even in the aftermath of an emergency. Assistance to reducing child marriage and teenage pregnancy is another key focus. UNFPA will support the rollout of gender-sensitive, comprehensive sexuality education in accordance with international standards. UNFPA also looks forward to contributing to the historic transition and peace building in the Bangsamoro Autonomous Region in Muslim Mindanao. We will not stop until we see no maternal death, until we see no unmet need for family planning, and until we see no gender-based violence in the Philippines. Because for UNFPA, everyone counts, and together, we will not leave anyone behind. Maraming salamat po.